Well, shall we go ahead and get started? I'll call the roll. I'm Peg Miller and Peter Buckley.
I'm here.
Dr. Brown. Brittany Kasim Carew.
I'm here.
Great. Peg King. Khalid Thorne Ladd. Christopher McMorran.
Here.
Joel Melton.
I'm here.
Great. Ruby Ramirez. Julie Systream. Jillian Wesenberg.
Here.
Tennille Weatherall. And Kate Wilcox.
I am here.
Great. And joining us for the steering team liaisons, Robin Hill Dunbar and Pamela Ferguson.
Glad to be here.
Great. And also from Coves, Rebecca Brown, who and she, along with Beth Green, have done a great job of organizing this meeting for us. So thank you.
Thank you, Peg. And just to let you know, Dr. Brown joined while you were calling roll.
Oh, great. Welcome.
And Peg, do you mind if I just give a clarification? I am currently still the co-chair with Pamela, and I was asked to join this meeting as Ruby was transitioning off as one of the philanthropic partners. So I'm actually here wearing, I suppose you could say both hats, but
Great.
A philanthropic partner. So
Thank you. Thanks for clarifying that. We would like to welcome a new member, Jillian Wesenberg. Am I saying your last name right?
It's Wiesenberg, but both my names always get mispronounced, so you're doing a fantastic job. So thank you.
Thanks. Brenda Kamini has left the committee, and Jillian is now a representative from the Early Learning Hub directors. And can you tell us a little bit about yourself and where you're from?
Sure. I was originally born in England. My parents experienced World War II in the bombing, came over to America, and have worked in social services all my life, worked with pregnant teens, worked with lots of different things, was a Commission on Children and Families director from Douglas County for 20 years. I have now been with the South Central Early Learning Hub, which is Douglas, Klamath, Lake counties, and the Cow Creek Band of Umpqua Tribe of Indians, and the Klamath Tribe's been with this since the inception of hubs, which is 2014. Excited to be here. I've worked with Robin Hill Dunbar for a long time. I'm excited because we were working with them with the home visiting for Douglas, Klamath, and Lake and the tribes, and it's just been a phenomenal experience. I'm a strong believer in home visiting, and I'm looking forward to contributing.
Well, thanks a lot, and we look forward to you joining us, so thank you. If we can go around now and just introduce yourself and what organization you're with, and maybe share one hope of what this committee can do for home visiting this year. And I'll start. I'm Peg Miller. I'm a pediatrician in McMinnville and on the Early Learning Council and co-chair along with Peter Buckley of this committee. And I guess I sort of have two hopes, but the one that is near and dear to my heart is I hope we can begin to normalize home visiting so that it becomes as commonplace as prenatal care or birthing classes. Peter, do you want to go next?
Sure. And Peg, before I do, I just want to note in the chat, Rod has put in that he and Nancy, how they're here. And we're glad to have you both to join us. The more the merrier when it comes to home visiting programs and trying to raise awareness. I'm Peter Buckley, member of their Learning Council. I work with Southern Oregon Success to collaboration and support of children and families in Jackson and Josephine counties. And my hope is that we raise awareness. Can you raise awareness? It was interesting going to the Senate committee to testify, and the number of senators who just really had no knowledge at all of home visiting programs. So we got a long way to go to raise awareness where it needs to be. And I'll toss it over to Robin.
Thank you, Peter. Well, I couldn't, so I'm Robin Hill Dunbar. I'm a Director of Children, Youth, and Families at the Ford Family Foundation, and very excited to be here. And I have known Jillian for a long time. It's good to have you here at this table, Jillian. I think if I had a hope to build, yes, raise awareness for the importance of home visiting. I think a lot of work has been done in the state, but really for me, adding on to that would be adding the importance of the uniqueness of the home visiting field being cross-sector, cross-organization. And while each organization has their own home visiting model and each of them are important, the way we look together, that cross-sector nature of the systems development work is what I hope that this committee really elevates and unlocks what it takes to do cross-sector shared work. And I'm real excited about that. And I will pass it over to Pamela, my co-chair on the steering committee of COVES.
Thanks, Robin. And hi, everyone. Pamela Ferguson. I use she, her pronouns. I'm the home visiting systems manager at OHA, Oregon Health Authority, Public Health Division, Family and Child Health section. And as Robin said, I've been the co-chair of the COVES steering team for the last, I think it's been the last year. And really enjoying all the work. And I think my hope is that we stay focused down to the local level and we start building those connections and networks between this great system that we're building, but build it all the way down to the local level where the support is really needed. So that's my big hope. And with that, I'll pass it over to Kate Wilcox.
Thanks, Pamela. I'm Kate Wilcox. I use she, her pronouns, and I am the Family and Child Health Section Manager. So I work with Pamela over in the Public Health Division. And I'm glad I didn't have to wait to being the last W because I often am, and then all the good ideas are taken. But but building on that, you know, this is a year of sort of uncertainty in terms of funding, both at the state and at the federal level. What my hope would be to kind of build on what Pamela and others have said is to take what we have and really anchor it and strengthen it and get it aligned so that what we have is working as robustly and coordinatedly as possible. Because then at that point, I feel like we have a better sense of what more we need to ask for to really make home visiting sort of a universal option, to sort of what Peg and Peter were saying, where it's as common as any other form of healthcare or social and community expectation for families. And with that, let me see, I got to see who else is here. Let's see, Joel. Hi, Joel.
Hello. Hi, everybody. Joel Metlin. I'm the Deputy Director of Programs for Department of Early Learning and Care. And just thinking about this question for a moment, DELC is still a relatively new agency, so there's a lot of work we can do to organize ourselves in a way that helps really advance the system as a whole. So we have portions of it that we manage through various programs. And if we can really understand the larger vision and direction for home visiting in general in Oregon, then I can do my work of trying to make sure DELC's doing its portions and is organized in a way to be successful at doing that and to work with its partners. And with that, I will turn it over to Dr. Brown.
For some reason, I knew you were going to call me, Joel. So here I am. Great question. This is difficult for me to answer. So I think I'm going to say a little bit of what Kate just said. This has been a rough start to 2025. And so I'm hoping for my own mental health that I'll be able to get through this year, in the skin that I'm in and the role that I play and everything that we hear that comes out of the Oval Office. It's very unsettling. And as I have the pleasure of serving the state as a policy advisor, and knowing that 64% of the funding from DHS comes from feds, it has me really concerned because 1 out of every 3 individuals in the state is connected to DHS. And so have a lot of concern, have a lot of unsettling inside my own mind and spirit. And so I'm just hoping that I can finish this race strong. And at the same time, pull other people alongside me so we can just finish together. So that brings me hope. To let me know as an individual that I'm not in this race by myself. And I will pass this to Brittany.
Good afternoon, everybody. My name is Brittany. I am a policy and program analyst with the Oregon Housing of Community Services Department. I think this is my second meeting. And my hope for the committee is, I think I agree with what people said earlier, is raising awareness and honestly building a stronger connection with not only my department, but other government departments to really see how we can guide our policies and just team together to kind of accomplish the things that we want in this committee. I will choose Rod.
Hey, good afternoon. I'm Rod Belknap. I'm the director of the Eastern Oregon Early Learning Hub. And we're one of the regions that does home visiting systems coordination. We also do coordinated enrollment for Preschool Promise. So one of our hopes in our region moving forward, where Preschool Promise is different from Head Start. Head Start comes with a lot of wraparound services, but using home visiting systems to possibly connect Preschool Promise programs to those home visiting programs to get some of those wraparound services that they may not get with Head Start. So that's a hope and dream in our region. I'll pass it to Tammy Doctor since I drug her along today.
Good afternoon. I came along willingly. I'm Tammy Doctor, I'm the Home Visiting System Coordinator in the Eastern Oregon region at the Malheur Early Learning Hub. And I serve Baker Rollout and Malheur counties, and I've been in this role for almost 2 years now. And my hope was going to complement what Pam said, that I would hope that I can help connect this system from the bottom up where I'm doing the work locally. So that's my hope. Thank you all for having me here today.
Christopher, do you want to introduce yourself?
Sure. And let me know if y'all can't hear me. Sometimes there's weird. Okay. Sometimes this computer is weird in here. I'm Christopher McMorran. I'm Chief of Staff to State Senator Lisa Reynolds, who represents much of West Portland and then into Northeast Washington County. And she is the chair of the Senate Committee on Early Childhood and Behavioral Health. So obviously, we care a lot about home visiting and everything related to it. And I think to answer the question, I'll say what I think we often say from our perspective in the legislature, which is just hoping to help present more of like a unified voice for what home visiting needs. I think a lot of legislators support home visiting and like the sound of it and like the idea of it, but then they get a little lost in the weeds around all the different programs and how to support them and how they all have different needs, and they're all sending individual lobbyists talking about individual things. And I think it makes it hard for that goodwill to be translated into good action. So I hope that's something that this committee can help with, is educating and sharing and presenting that voice for our legislative colleagues who really want to support and are just trying to find sort of a straightforward path to do that. And with that, I'm trying to think who hasn't gone yet. Rebecca, have you gone?
I have not. Thank you. Hello, everyone. I'm Rebecca Brown. I use she and they pronouns. I'm the State Home Visiting Transformation Manager at COVES, which is the Center for Coordinating Oregon Home Visiting Systems. And I'm excited about the work that the committee is taking on around kind of looking at fiscal strategies, identifying funding streams and how they're operating to kind of establish a baseline for understanding how funding for home visiting is working in the state. And then hopefully being able to advocate for increased funding and efficiencies in funding. So thank you. I will pass to Dana next.
I had a feeling that was going to happen. Hello, Tanchi, everyone. My name is Dana Castano. I am with the Department of Early Learning and Care. I work in the Office of Tribal Affairs as the Oregon Tribal Early Learning Alliance liaison. And I guess what I'm looking forward to, what I'm hoping that this group can do in the next year is have intentional and genuine outreach to tribal nations and be able to involve them in this work if they would like to, and to build a relationship with tribes who do want to be involved in the home visiting work. And yeah, that's it. So I also am not quite sure who hasn't gone yet. What about Drew? I don't think Drew's gone.
Drew left the meeting for now, but I don't think, Paula, did you get a chance?
Hello, my name is Paola. She, hers, ella pronouns. I'm with the Early Learning Hub of Central Oregon. I'm a home visiting system manager. And what I want at least bilingual visitors. I think that interpretation services are amazing, great tool, but they don't replace a human being, the interaction and the connection that our families need.
And I think just Peg is left.
Yes, good afternoon, everyone. I'm driving, I'll be on camera shortly. Peg King, I use she, her pronouns. I work at HealthShare of Oregon, the CCO in the Tri-County Metro region. I oversee the Children, Youth, and Families portfolio there. I think my hope is that we, similar to what others have said, is I just feel like we need to really listen to what the local folks are saying, the wisdom that they have in running these home visiting programs, their hopes, their worries, their challenges, their ideas for collaboration, because that is really where a lot of it is happening. I work very closely with all the home visiting programs in the 3 counties up here. So I just want to make sure we ground in their wisdom.
You're muted, Peg.
Oh, I forgot Beth. Beth, do you want to introduce yourself?
Sure, I forgot myself too. I'm Beth Green. I'm the director of COVES. I'm at Portland State, where I'm also the director of early learning, early childhood research. And my hope is that we can support all of the things that you all just shared. And I feel like we've had such a great foundation and have taken some steps this year that I never dreamed would happen for home visiting cross-sector coordination. So I'm just really excited to be supporting all that.
Yeah,
thank you.
Thanks. And thanks to all the folks associated with the hub for attending the meeting. So we appreciate that. Sort of talking about the goals that we hope to accomplish today, we're going to learn about what's currently happening with the home visiting work system and kind of what has happened in the last couple of months since we met. We hope to build a shared understanding of the early childhood home visiting landscape, and that's a great document that Coves has generated. And then identify kind of what the next steps to advance the recommendations that came from the home visiting landscape report. So to accomplish that, I think I'm going to have Beth explain what's been going on with her agency or group there.
Yeah, thanks, Peg. So just a few updates. It's been busy for the Coves group and for others we were working with. As someone mentioned, we did present an informational at an informational hearing for the Senate Early Childhood and Behavioral Health Committee, and both Peg Miller and Peter Buckley were part of that, as well as Paolo, and just really welcomed a chance to speak both to the committee and to the Early Learning Council last week around the work that's been happening and sharing. We had a couple of parents who participated in that hearing as well, just talking about how home visiting has made a real impact, and trying to do a sort of a 101 for that behavioral health committee and those many new senators. And then with the Early Learning Council, really lifting up some of the things from Central Oregon, Yamhill County, and Washington County that have been happening at the regional level, and talking about recommendations for how states can really support that regional work. So that was also exciting. The Home Visiting Partnership. So this is the group that's been, we are working with Kara Copeland, who has organized a cross-program, cross-agency, what we're calling the funding partnership. And that group also they helped us do the legislative informational hearing, as well as setting up that meeting in a beautiful way so that we were talking about different programs, and both the Healthy Families Oregon and the NFP programs also presented to that same committee at the same time. So again, just trying to get the message that it's shared advocacy for home visiting, and that all these programs together create a network that's really important for Oregon's families. So trying to get that organized, and just really a lot of enthusiasm from the different models for partnering and communicating the need for home visiting with this message of, they all need support, they're all valuable, they all serve a purpose in the network of programs. We are also moving forward with the home visiting fiscal study work group. So we will have our first meeting next week. We have selected a contractor, which is P5 Fiscal Strategies. And we meet with Gina Caputo, who's the lead for that, that agency or organization, next week to really dig into getting that work moving forward. So we do have a work group that's comprised of a variety of folks, some of whom are on this committee, some are on our steering team, some are on our home visiting model collaborative. And that group will be meeting regularly with Gina to make sure that work is advancing, and I expect to have more updates to this committee as it moves forward. The purpose of that, as someone had said originally, is to really do a fiscal map to understand where are all the funding streams that folks are drawing from for home visiting. Are there places where we could make better use of potentially available funds? It's really, as someone also said, it's a really nervous time for folks around funding. So hopefully this will at least help us to understand where things sit right now, knowing it's a very volatile landscape right now. Family input work group. So one of the things that we have done and supported this year through our Coves team is what we call our family input work group. And that group's been meeting since this summer. And they are going to be providing their final recommendation. They would recommend we consider for a standing, lasting, hopefully sustainable structure for family input at the state level for home visiting systems. So we will have those recommendations to our steering team preliminarily next week, but then a more fully fleshed out version of those recommendations for consideration in April. So I imagine when we come back in May for this meeting, we will have recommendations for what that's going to look like moving forward. So I'm really excited about that. Okay, cross-agency. Oh, another work group that's moving forward is our cross-agency data work group. This one's just getting going. And the idea here is that our evaluation director, Callie Lambarth, in partnership with some folks at DELC, who have been in the past asked to compile data across different home visiting program models to be able to paint a picture of how many families together to develop a plan for more regularly bringing data back together, and then hopefully being able to dig into the data a little bit more in terms of racial and ethnic characteristics of families being served, geographic, where they are, what ages of the children are being served. So we have more regular compiled cross-agency data. So we'll be reaching out to various folks to participate in that work group. And we will, if you have suggestions for anyone from your agency that you think might be a great participant, do let us know. We have right now a list of the folks that we've worked with before who have provided data for those sort of cross-agency data compilation. So that's that piece. We're also talking with that group, and we'll be talking about how to start to incorporate data from tribal home visiting, knowing and recognizing that that is a little bit longer journey because of the data ownership and the sovereignty of the tribes, but starting to think about that piece as well. And then the final update is that we sent, I believe, copies to all of you, 2 things that were approved at our last steering team meeting. One was our theory of action. That we're actually working with a graphic designer now to get a prettier version of that, but that's a 1-pager that really outlines sort of what we think it's going to take to move the system in terms of resources, key buckets of work, and then expected outcomes. So you all received a copy of that, and we will send the prettier version when it's done. And also our COVES Year 2 work plan, which we also shared with you all. So that was a lot. Any questions on any of that from anyone? All right.
Thanks, Beth. And as everybody can see, Beth and her group have been busy. So, but what we'd like to do now is to hear what updates or information that any of you would like to share about what's happening with regard to home visiting in your organization. So whoever would like to share that, we'd love to hear about it.
Dr. Miller, I can go.
Sure.
I will only go first just so my internet is working. So at least I'll be able to say what I need to say. So at DHS, and many of you know this, that I get the privilege of working in the director's office. Definitely miss Joel and, his leadership at DHS. So Joel, we definitely miss you. But it's good to be in this space. I'm very excited that this team, there are several people here that we have the luxury of meeting with the Early Learning Council, which is led by Ms. Sue Miller. And so last month of February, it was a focus on home visiting and exactly what is our agency doing to best align not only with our external partners, but just how we're navigating through so many executive decisions that are coming out of the Oval Office. And so it's been kind of topsy-turvy. But I am glad to say that our leadership at DHS is still plugging along, staying strong. And our theme for March will also be housing. And so we're going back and forth as an agency, not only tracking so many legislative bills. It's ridiculous. I think this session, there were well over 3,000 bills that are like in process. And so it's been a tough, kind of a tough and crazy start to 2025, but we're mostly excited just to continue our partnership, not only with ELC, but with a variety of other partners throughout the state. So
great. Thank you, Dr. Brown.
Mm-hmm.
Who else would like to share what's going on in their organization? Kate or Pamela, anything going on in OHA?
Good thought. You know, it feels like it's kind of, we're just keep moving along, business as usual, keep the trains rolling and going forward. I think for the next meeting, we'll have some news to share around Family Connects and our new commercial payer rate, which we're looking at it being significantly higher, mostly because we have learned a lot since we set that rate 2 years ago. About the program and what it takes to run the program, and subsequently what it costs to run the program at the local level. So I don't want to get ahead of the news going to the commercial payers first. So I will share that at the next time we meet. So
great, thanks. Who else would like to?
Hi, this is Joel from Delk, and I can say,
Great.
you know, the real focus for us these last few weeks was just getting in front of the legislature, the Ways and Means Subcommittee on Education, and really trying to explain what we do. And that includes home visiting and how it fits into the larger system, just so that committee can make informed decisions. And we got some great questions, and we're doing follow-up. And really, that's a real focus for us right now, is just making sure people have the information about what the money funds, the importance of it. And if there's any extra money out there, we could definitely use it. So that's been a focus for us while we continue the daily work of things like continuing to stand up the HFO database and some of these other core pieces that we're still at work on. Thanks.
Peg, you're muted.
Oh, I was, thank you, Joel, for sharing that. And I was including the, our visitors. If there's anything going on in your regions, we'd love to hear about it.
I'll go ahead. There's lots going on in my region. I've been working, well, Rod and I have diligently on getting and implementing an intake and referral process for the 3 counties embedded in our website, and keep working on revisions. And these things just take longer than I thought they would, but that's going to come to fruition in the next few months to augment the ways that home visiting agencies already receive referrals. In the past 6 months, I formed a home visiting network in Wallowa County for all the home visitors there. And there were already 2 in existence, one in Malheur County and one in Baker County. So I facilitate those each month. And the one in Wallowa County is going wonderfully. We're just working on all kinds of local issues and identifying, getting to know each other's programs and how we can join others to help families locally. And one other thing that I did recently was attend the Oregon Department of Human Services District 14, their CQI process. They have them quarterly, and they've invited me to help advise them on things that I can see as as being a former home visitor, and also as a systems coordinator now. And we worked on confirming safe environments at face-to-face visits and how their documentation and ways they could improve that. So I helped advise them on that somewhat. Those are just a few things. Yeah.
Thank you. Thank you. All right. Well, thanks everybody for sharing that. And it sounds like everybody's been busy. I think we're going to move on and talk a little bit about tribal home visiting. Rebecca and Dana.
Thank you, Peg. So just as a background, one of the early intentions of home visiting systems and home visiting advisories has been to include tribal leadership in advising, home visiting, and participating in systems. And over the last year, well, first Julie Seastrom, who's a part of this committee, but I believe is not present today, and predates Coves in terms of being on this committee, is part of tribal leadership for the Confederated Tribes of Coos, Lower Umpqua, and Siuslaw Indians, and but has been the only tribal member on the committee, and has expressed a few times a reluctance to more broadly be representing the 9 federally recognized tribes in home visiting systems. And about 6 months ago, we invited Dana Castano, who's present here today, onto the steering team, and she's been an amazing participant and guide in many respects as part of that committee. As part of that team. And then in the Home Visiting Collaborative, Danelle Smith joined, I believe, about a month ago, and she is the program coordinator for Confederated Tribes of Siletz Indians. And she and her team lead Family Spirit program model implementation through 11 counties. And as we've been trying to figure out, kind of think about ways for tribal voice and tribal leadership in home visiting systems, as we all build together, Coves brought together Julie and Dana and Danelle, and have been talking about what would be some important ways to move forward. And there was a suggestion for kind of a Dear Tribal leader to introduce more about home visiting and the systems that exist, and potentially Coves, to tribal leadership of the 9 federally recognized tribes in Oregon. And I will go ahead and pass that on to Dana to tell us more kind of about the process and purpose for that type of outreach to tribes to join in advising and offering leadership and perspective about what home visiting can look like in Oregon. So Dana, if I can hand it over to you.
Yeah, absolutely. Thanks, Rebecca. So, like Rebecca said, for the background leading up to it, there are 9 different tribes, and Julie is always very clear about only representing herself, not even the entire Confederated Tribes, Coos, Lower Umpqua, and Siuslaw, because she's only one member of a 7-member tribal council, and then each tribe as separate sovereign nations all are very different in the way that they do things, the level of home visiting programs that they have. And so really the purpose of a Dear Tribal Leader letter is, well, there's multiple reasons. So one of them is actually, I would say, a statutory obligation. There's a statute in Oregon about agencies consulting with tribes. And the purpose of consultation is to have a meaningful government to government conversations to formulate policies that impact tribes and to get feedback from tribes for agencies to make decisions. And so inserting a Dear Tribal Leader letter would be an opportunity for the agency to bring tribal leader perspective into forming the work of the home visiting system, whether that be this committee, Coves, one of the work groups, because similar to some of the community organizations that run their own like community-based home visiting programs, tribes are often left out because they're not part of this mainstream system. Like their data systems don't communicate with the state of Oregon's data systems, for instance. So there's many places where they're left out, and it's important that we learn from them, the appetite they have for being involved in this work, what their specific barriers might be. I mean, to see if they're interested in having dialogue with other local partners. So maybe there's a referral system that gets built out in local communities where someone might be picked up into from like a CCO for home visiting, but then that family would actually better benefit from whatever program the tribe has. So things like that are kind of the reasoning behind it. And so I also think it's important that we don't go too far into this work before bringing the tribes into more purposeful conversations.
Dana, can you tell a little bit about the kind of the pathway with a Deer Tribal leader, kind of like how that normally unfolds in terms of like the pathway, like a recommendation that this committee could make to move that work forward, or what would be needed in order for that to happen?
Great question. So DELC is developing a tribal consultation policy. Well, it's actually been drafted, it just hasn't been adopted yet, and there's a couple of like pieces. So there's really not a specific process that needs to be followed, but the recommendation would be for this committee to ask the ELC to ask DELC to write this letter, to write the Deer Tribal leader letter.
So in terms of process, would it make sense to like take some type of a vote or seek a agreement from this group to proceed with that, and then ask to have consideration of that be added to the next Early Learning Council meeting?
Yeah, I think that makes sense. I would also invite Joel to add anything, since Joel's part of, oversees the Office of Tribal Affairs at DELC and might have some other thoughts of how to go about it.
Sorry about bringing the tribal consultation policy. What's the exact question?
How would be best to begin the process of tribal consultation on behalf of the home visiting subcommittee of the Early Learning Council? I think is the question, right, Rebecca?
Yes.
That's a good question. I think whenever there's changes that we're advancing in any way, shape, or form or considering, that is the time of tribal consultation, but you have to be able to speak to those things. So if it isn't clear what we're doing, right, it's one thing. If we have an idea of the direction we're trying to head and how we want to get there, we need to be engaging with the tribes on that. And so that could be something that we do through our it's an interesting question of whether our tribal consultation process applies specifically to the Early Learning Council and what it does. I haven't really thought about that. And Dana, maybe that's a question we can take back.
Yeah, definitely.
But obviously anything that DELC is doing that's a part of that larger piece, we would have to do tribal consultation for. So if we were to contemplate any changes in how we administer, manage, design, etc., any portion of the system, we would need to make sure we're doing consultation about that, the tribes.
I'm curious because in conversations that we've been having, and I wish that Julie had been able to join us today. I think she had recommended this notion of a Deer Tribal leader letter that could be in some way cross-sector, but it sounds like it's agency to agency in terms of consultation. So I think that's kind of the puzzle that we were grappling with, of would that come then from the Early Learning Council that is sort of does have that cross-sector role for early childhood. So that was the question sort of that we were trying to get some feedback on about how that might move forward. And I know other agencies have their own processes for tribal consultation.
I will say that at least a few of the agencies have consultation policies based on each other's consultation policies. ODHS, OHA have the same policy, and then we designed ours based on that. So there are differences, but they're substantially the same.
So I'm wondering, it does feel like it the right elevation for our Dear Tribal Leader letter would be from the council, because it does represent the cross sector. Otherwise, I do think we would have to get all of our tribal liaisons together from the different agencies to figure out how best to do that work, you know, to do a Dear Tribal Leader letter. But, you know, I kind of leave that up to maybe the tribal liaisons from each agency to say, is that the right pathway? You know? I guess that's maybe a question for Dana.
Yeah, that's what I was wondering.
Yeah.
Jillian, you have your hand up.
Yes, let me lower it so it's not up there the whole time. When I first started with Hubs, and then in 2015, I was invited to a government-to-government meeting that happened in Douglas County. And what I learned very quickly was that the tribes that attended were really hurt that they didn't really understand Hubs, and no one had come, you know, really and explained everything. And so then it was left to me to be the messenger to share with them what Hubs were and what they were supposed to be. What I've learned from that is, I know that you all have agreements and you're all different departments, but my recommendation is to somehow let them know early on what's bubbling up and not wait too long for everybody to have their representative so that they feel included. That was what I learned from that really strongly. And when I first started with the Hub, there was a state grant with the Early Learning Division that was with Chiloquin, and it was given to me. And from that, with the Klamath Tribes, it was a phenomenal experience. And so my concern is, having gone to that government-to-government meeting, is please don't wait. Please, someone share what's coming down the road, and then you can all get together and do your consultations or whatever. But I strongly recommend that they're in everything from the beginning, and that they understand what the foundations are and what's being built. So that's just for me.
Yeah, I so appreciate that, Jillian. And I'm thinking, I mean, it's that's sort of how we're like, that's the message that we had gotten actually from Dana and Julie, like, at least let them know what's going on and invite more conversation so that there is that opportunity. So I'm wondering, it does sound like I'm to your point earlier, Kate, it's the council maybe that would offer sort of a cross-sector Dear Tribal letter. And I'm wondering, Peg and Peter, if that's Peg Miller, if that's something that you would think about being able to bring to the next council meeting for potential action. And then we could figure out like who writes that letter and what does that, like we'd work with Dana and other potential tribal consultants from other agencies perhaps. But yeah, instead of waiting, because it will take a while, I think.
Yeah, that sounds reasonable. And I guess the content of the letter is to explain a little bit about the goals and to solicit some input. Is that reasonable?
That seems reasonable to me, but I look to Dana for input on that.
Yeah, that sounds right. And this was before my time, but I do know that previously the Tribal Advisory Committee, which is technically it's a subcommittee of the Early Learning Council that was created to advise DELC on the creation of Tribal Early Learning Hub, which that's another conversation. There is no tribal early learning hub, long story short, and we're going a different direction. But the reason that I bring that up is because the Tribal Advisory Committee was consulted about the Raise Up Oregon 2.0. And so at that time, Remy, who was the Early Learning Council Administrator, I believe was her role, had brought that there. However, because the Tribal Advisory Committee is really limited in their purpose by statute, that's not really the right place. And DELC wasn't, I don't think we were even an agency then. I think we were still the Early Learning Division when those conversations happened. And so now that we've grown and developed what tribal consultation looks like, I think that's a better route to go. And that we're similar to the story with the early learning hubs that Jillian mentioned. We want them to be involved and be able to shape whatever this home visiting systems looks like earlier on, and not be heard and told about it after everything's created. We've all talked about it. There's nothing else to talk about.
Dana, thank you so much for coming today and helping us to understand what's happening and a potential future process. It sounds to me like we have an agreement with Peter and Peg to move that forward to the Early Learning Council at the next meeting. Is there anything more that that we would like to talk about around that topic now? Kate?
Just a point of process. When we get something drafted, we probably should run it by the tribal liaisons for each of the agencies, so they're fully aware of what's going on. Because I know I would want to make sure that Julie Johnson knew what this was all about, so that there's no surprises.
Thank you, Kate.
Any other suggestions around process? That was really important. Red flag there, or not red flag, but just heads up.
Okay, thank you. We have Drew Strayer present for a next topic. I'll go ahead and share my screen again, but welcome, Drew.
Hi. Thank you all for welcoming me here. Appreciate being here. And just kind of want to present a little bit really briefly about MCV. I'm sure most of you are familiar with the MCV funding program, at least in basic. And one of the realities that we have within this federal funding structure is that we need to have an advisory committee. And in the past, it has looked a lot of different ways. Most recently, it was a form signed by 4 folks who would receive updates about the MCV program and provide insight and advice. HRSA, the Health Resources Services Administration, they have established some goals, some guidelines for the maternal infant early childhood home visiting state programs. They're different in every state how they implement them, but some of the commonalities would be that it's an opportunity both for the MCV project director, which is myself, to provide reporting, but also an opportunity for others in the broader home visiting system to provide advice to me or to my colleagues in other states. And to that end, wondering if I could propose a suggestion or a request rather, and in support of it, I just want to provide a little bit of the background here from HRSA. So they want to make sure that the funding recipients which is Oregon's McVie program, would be involved in activities that support the coordination of services in communities at risk for poor maternal and child health outcomes. It may include participation in, and it lists a variety of entities, state early childhood advisory council and planning efforts, plans for McVie expansion, enhancement, community capacity building, sustainability, and financing in collaboration with partners. So really, they just want to make sure we're playing well with others, we're getting insight and advice where possible, and providing reporting for accountability across the home visiting system. Those are all goals we hold very closely as well. One of the elements of that is to have a written agreement, and that can look a lot of ways. I mentioned it a moment ago. The last one that we had in effect was signed by Director of Early Intervention and Early Childhood Special Education through ODE, Director of Child Welfare Division of ODHS, our own Kate Wilcox, Maternal and Child Health, now Family and Child Health Section Manager and Title V Director of OHA, and the Director of Early Learning Division at that time within ODE. And those were the 4 signatories that we had before, who we, as the McVie, Oregon McVie program, would need to report back to. I can't see any participants. I'm kind of going blind here, but hopefully, there we go. Thank you. Hopefully this is making sense at a level. I can provide a little more update, but wanted to ask first, are there any questions so far? All right, I just scrolled through the participants. I don't see any hands up, so I'm going to keep rolling. Okay, so to that end, we have to have a written agreement that's in place every 3 years. And my request for y'all to consider would be, is this a place, the Home Visiting Systems Committee, is this a place where we could provide a brief update on a semi-annual basis, maybe 3 times over the course of the year, provide a very brief update about what has been going on with McVie funding, which, being a federal funding source in the days that we are living in right now, means we have to pay attention all the time. We are constantly listening for any updates. I will say we have had great interaction with our federal project officer. Her name is Erica. She's been a phenomenal resource for us and has maintained connection, aside of a little bit of radio darkness for a time, has maintained connection with us, which has been a really wonderful resource. But it does mean that we do have to constantly be attentive to what might be changing at the federal level. We are currently funding 3 different models of work, not the entirety for any of those models, but we are funding into the work of those models, and that's Nurse-Family Partnership, Early Head Start, and Healthy Families America, or as implemented here, Healthy Families Oregon. And currently we are operating in 13 different counties that have met what they've determined to be the McVie needs assessment as counties that have that have crossed the threshold of needing this additional support. And we are working with 18 different entities in those locations. Some of them might be counties, some of them would be early learning hubs, and others are nonprofit and other agency providers of those home visiting services. And our goal would be, like I said a moment ago, providing updates on those things, but also offering the opportunity for any or all of you to provide advice to us, things for us to consider how we implement McVie funding and how we utilize it here in the state of Oregon. And so not wanting to put another meeting with all the usual suspects on anyone's calendar, the thought was perhaps I could provide the update and invite anyone who was interested to a separate conversation as an opportunity to provide advice that was of greater length than these meetings would be ideal for. I really don't want to take up anyone's time in ways that's sort of maybe not core topic for you. But at the same time, we do desperately want the advice and wisdom of leaders throughout the state as we implement this funding here in Oregon. And so the thought would be to have a separate conversation for some of those, inviting family leaders, inviting some of the model representatives and model leads across the state in the models that we fund, as well as incorporating some voices from the local level at the implementation level and the system coordination level across the state where we work. That's the general idea at this point. Wondering if there are any questions now. I see a hand. Peg King?
Yeah, hi. I think conceptually it makes a ton of really good sense. I'm curious, how often would you, like, is there a requirement, like how often you would have to come to this group to provide updates? What would the cadence be?
There is not a formal requirement from HRSA. My tentative ask, just to get it out there, would be 3 times a year, if that were possible. It would give us opportunities to connect during mid-year when we have some data that's come through. It would give us an opportunity to connect at end of year and beginning of year when we have our contracting happening. And ideally, there would be another time during the course of the year to actually talk about some of the difficult decisions related to funding. The costs, it was mentioned earlier in this meeting, costs for programs are going up all the time. And the federal funding for the McVie program is not changing. Our base rate is staying the same. There is some additional limited funding that has been provided. It is time limited basis, and so not something that we can really build a structure off of, but it is something that definitely helps. But there are hard decisions about funding, about contracting decisions that we definitely would appreciate the wisdom of others. And frankly, I appreciate the accountability. I would love to have people looking over my shoulder saying, hey, Drew, you sure that's the right choice? Hey, team, is this something that's going to impact Oregonians the way we really want it to? That kind of accountability and transparency is vital as public servants, and I want to make sure that we have established that in a robust way. So the initial request would be 3 times a year, if that works.
Yes, I keep hearing from Multnomah, Washington, Clackamas about the cost of these home visiting programs keeps going up. The cost of nurses, it's just not tenable at this point. And some of the models require nurses and not community health workers. So it's, I'm well aware of all of the struggles, but I think it makes a ton of sense.
Thank you.
And would help us align all this stuff, right? So there's not 5 million advisory boards to the 5 million programs and all that.
Kate?
Yeah, I just wanted to put in another plug. This is the funding source that is supporting the lion's share of COVES. And so I think it really makes sense to have this align with, we're all kind of in the same space together. We're hoping that down the road that we'll get some other funding for COVES. But in the meantime, McVie really is putting out a lot to make sure that this gets anchored and gets moved forward. So.
I agree. This is a great place for this. And a process question for Peg and Peter and Peg. Since this is being a new structure of having an advisory under this subcommittee of the council, does it go back to the council for, is this something we haven't done before? So as a council member, I'm curious about process.
I would assume that that this committee has the ability to take on an advisory committee. I think we'd report it to the to the full committee. But I don't think we have to make an emotion for the full committee to approve. I think that it's well within the subcommittee kind of framework.
So the subcommittee could approve taking on the role of the advisory board that Drew is requesting. Is that what I hear you saying, Peter?
Well, I'm just kind of thinking of like, I think in the legislature, if you had the House Education Committee, you wouldn't have to go to the whole House to ask for permission to have an advisory group. You could just appoint an advisory group to the House Education Committee. Or invite an advisory group.
Do you think we need to have a vote, though, of this committee?
Yeah, it would be helpful to have a vote of this committee, yes.
So if there are no other questions for me, I will step away to give you all the moment. And then just let me know if you'd like me to come back. I really appreciate you allowing me this time, the opportunity. Really appreciate the work you all are doing. Thank you so much.
Thank you, Drew.
Yeah, thanks, Drew. Do we need a motion then if we're gonna vote?
Yeah, I'll make a motion, Peg. I'll make a motion that we invite the advisory committee as recommended.
I'll second.
Great. Any further discussion? All those in favor, either virtually or a thumbs up? And anyone opposed? I think that motion carries. Okay.
Thanks. Thank you, everyone. I'm very excited and I really appreciate the McVie team, Pamela, to you also. I know you were involved with this notion of both transparency and like, let's bring all the home visiting advisory work. Let's coordinate it. Let's align it. That's what we're about. So I'm really excited to see this move forward. Thanks, everyone. Okay. And I think it's to me now. All right, we only have 20 minutes left. We've had a robust discussion, but I think we can make some progress today. So at our last meeting, you all got a first look at the recommendations coming out of our home visiting system landscape report. And today we wanted to dig into sort of one of the sets of key recommendations. So just as a quick reminder, we have recommendations in 5 key areas. One around cross-system, strengthening early childhood home visiting guidance or governance, I'm sorry. The second area around ensuring and building and strengthening family leadership for state and regional partners for home visiting, supporting centralized and coordinated intake and enrollment for families, building community awareness and making home visiting the norm. And then the 5th area around financing. We've shared some of what we're doing in that area with you already today. So today, what we wanted to do was dig in a little bit to some of what we heard around asking for more clarity for cross-sector state level guidance. So now, Rebecca, if you could advance to the next slide, thank you. And there were kind of 3 areas in which we heard in our conversations and meetings and information gathering from regional partners that they would like and feel it would be a benefit to have some more guidance around some of the expectations for home visiting systems work in terms of governance, in terms of inclusion and expectations for inclusion, including families at the regional level specific to home visiting lived experiences and perspectives. And then the 3rd area around having guidance and clarity that work will happen at the regional level around intake and referral. And we know a lot of work is already happening in these areas at the regional level. So the other thing that we heard loud and clear was we would like and think it would be beneficial to have more clarity from our state partners And we would like for that guidance to be flexible and allow lots of flexibility in how regional partners do the work together. So my takeaway from that was listening to those partners, and we have some today who could share or disagree with me if this doesn't sound right, but that there's an expectation that home visiting system coordination will happen, that will include family leaders, and that will include working on plans together to coordinate intake and enrollment systems and move that work forward, but that the guidance not be so specific and prescriptive that regional partners feel that they have to dismantle some of the great work that they've already done. So I'm going to pause there for any questions with me so far. So the ask is for better cross-sector state guidance. And we talked about this at the last week's Early Learning Council meeting as well, and got some input around that, and wanted to bring it back to this committee to help us dig a little deeper into what that would look like. We had some folks who said, absolutely, if we could do, again, truly cross-sector guidance, as opposed to one set of guidance coming out of DELC, one set of guidance coming out of, OHA, one set of guidance coming out of ODHS, and maybe they don't all align or look the same, but how can we create something that's really shared across agencies? So our team took that back, and we started to realize where we had some gaps in terms of knowledge that we hoped that you would help us fill today. We were pretty good, I think, at recognizing the key sort of state level partners. But then as we thought about where does that guidance go at the local level, and who at the local levels we want to make sure is hearing about, providing input to, helping co-create some of that guidance. What are those local authorities? And are there any other state agency partners? For example, I'm noticing we don't have housing in here, so that might be a miss on our part. What would be the steps in terms of actually beginning to create some of this shared guidance? What are the local authorities? And then what is the mechanism? We talked about this, and Kate, you were very helpful at the Early Learning Council meeting in talking about where does the guidance come from? Where is the mechanism in terms of working with local public health, for example, between OHA and local public health? So this was what we wanted to get your thoughts about today. Does this make sense to folks in terms of an ask? Or it may be that you want us to talk to someone else in your agency about this, which is also fine. You could just let us know. But what we want to do is be moving forward so that we can be responsive to this request for shared guidance. Hey, Peg King.
You're not going to call me by that other nickname from the other meeting the other day.
That was the best. I really should.
I mean, I wonder, to the point of Rod's point in the chat, and I wonder, if starting with some of the maybe the rural counties, or for example, Washington County, I think has done a really amazing job at bringing all the cross sectors together. The hub, the CCO, the Nurse Family Partnership, all the people in sort of a P3 advisory council. So I don't know, I just keep thinking of, I think starting with an environmental scan of who's maybe already kind of figured some of this out, rather than it coming down from on high. I don't know that would.
And that is partly what we did, in large part what we did with the home visiting landscape report, was trying to figure out where that's happening, who's involved at the regional level. And of course, what we learn, not surprisingly, is that regions are all over the place in terms of how they're doing it. Some are doing it really well, like Washington County, and some have not really started or engaged much around home visiting systems. So the question was, or the recommendation was, if there were more clear date guidance, that then we could elevate and get everyone sort of moving towards better systems regionally. Does that make sense?
Yeah, okay. So then I don't have an answer.
So Dr. Green, I have a question.
Yes.
So in theory, the goal would be that these agencies or these entities that you've put there, that they would be better aligned toward one purpose. Is that what we're asking for in theory?
I think that's right. Yeah, I think what we're asking, what the regions asked for was like, I'll just give an example of, and Jillian, I want to put you on the spot as the hub director, but so hub director said, right now, we don't really have clear expectations for our role in early childhood home visiting system development. Like we're paid and supported to do cross systems work broadly, but we haven't necessarily given the capacity, we haven't necessarily taken that on across the state in an equal way. Some like Jillian, South Central, you've been doing that for a while, in part because you've had some funding. So I see you nodding, so I think that was right.
Yeah, I
But
think that the
was- yeah.
funding made a huge difference. You know our home visiting coordinator, Vanessa Pingleton. And what we were able to do was we were able to start with information and referral from the very get-go. So we have an actual database and we have a system called Community Uplift, and we have community health workers, and they do motivational interviews when parents or providers call or contact us, and then we can refer them to agencies, and then we do the follow-up. So it's a closed loop system where we do the follow-up to make sure that everything happens. And as Rod said, our database is also used for our preschool promise. And so we integrate the parents from preschool promise and connect them to services, because that's part of the contract for all of the preschool promise, is to have some kind of way to have information and referral for their parents. So it's a beautiful fit. We have an MOU across the region. Vanessa was wonderful about the home visitor work. So that was one of their first projects, and it was huge, and it's just been phenomenal, and the hub is overseeing it.
Peg, did you have a question? Your hand is still raised. So I'll give you an example. So we're starting to work with DELC's hub technical, I don't know if they're called technical assistance providers, or no, that's not it, but the hub program staff who manage the hubs, the DELC program staff who manage the hubs, to talk with hub directors around that piece of guidance and what input they might give us. But like if we wanted to reach out to local public health, what would be the mechanism? If we wanted to reach out to ODE, is our local interagency coordinating council is the place where we might want to go. And then ODH, where's the mechanism for ODH to get, where would guidance come from at the state level around shared work for early childhood home visiting, and where would it go? Like who would be the local partners that it would touch? Kate?
Yeah, I think maybe as a starting point, it might be really, and I think I kind of shared this a little bit at the council meeting. It's everybody has different people that they are, that they have to report to or are accountable to. And that includes like different statutes, federal grants, state statutes, whatnot. So that's sort of the mandate side. But it might be good in this sense to start with sort of a what's in it for me side. And if we could put together something that said kind of a talking points or a white papers too, like formal, but some sort of a 2-pager, like what's in it for me. So like we would take it to the public health, to CLO, local public health, and say, look, we're trying to coordinate home visiting. Here's how it benefits you. And we had sort of a common message around that to try to encourage participation, and in that way start to set that expectation. And we can say it's our expectation from the state level that everyone participate. We can't mandate it, but we can encourage it, and we can say why it's important for your participation at the local level. And so it would be sort of coming up with some of those those points, like what is in it for them? How does this leverage? How does this benefit? I mean, because, you know, we still have lots of history that still exists down there at the local level that we're trying to work with. And so, so I think that could be a starting point.
I love that idea, Kate.
Yeah,
there
and
other
funding does
ways-
help too.
Yeah, funding does help, yes. And we know there is some out there that folks have leveraged and used. Are there other groups that other agency partners who are part of this call, like in terms of ODHS or OHCS, CCOs? I don't know, is there like a collective, where would we go for a collective invite or ask of CCOs?
I mean, nothing is coming to mind specific to home visiting.
I know that there's a Senate bill that's going to be, is the Senate bill requiring or asking, I don't know, local CCOs, I should know the language better, but local CCOs to partner with early learning hubs?
Yeah, but we all do that anyway. No? I mean, it's in our contract anyway with OHA.
I think it depends on how you define those words.
Yeah.
Yes. Yeah,
Right.
when we
You do it well, Peg.
Okay.
When the
That's all I do.
when the social emotional metric was being developed, there were some CCOs who didn't even talk to the hubs about.
Yeah,
this.
I'm aware. Yeah, so that Senate bill, I think it's to prioritize CCO, it's to incentivize, or make CCOs prioritize infant and early childhood and partnerships with relevant agencies. Yeah, I've seen that.
But I'm wondering, do the CCO medical directors still get together?
Yeah, they do. But
Okay,
like,
so I'm trying to
that's
think
what I
of
was first thinking of is
places
that
where-
meeting.
Yeah.
I just don't think, and our medical director, who is very pro maternal child health, I don't think she'd have anything to say about this, about home visiting particularly. It's like a little too in the weeds, I think. Let me think about that.
Yeah, we can follow up with you, Peg. Other folks? Now I know ODHS has district branch managers and those folks meet on a regular basis. I don't know if that would be the right level of folks or whether it'd be better to, I know and again, it's a similar situation to CCOs, like some districts have been really engaged with hubs in the early learning side and others have not as much. So I'm wondering, Dr. Brown, do you have any suggestions for us on that?
Well, I think you just said it. So obviously, when it comes to DHS, every district has their district manager, and the way that they do home visiting could be slightly different from someone else's district. But at the end of the day, it's still going to be how do they best support, their families and their children. So that's going to be there. So that will be my recommendation, only because in the director's office, no one in the director's office, including myself, none of us are at the program level, right? We're not doing the actual work. And so our job is to manage the work, support the work, do whatever we can just to connect folks, make sure they have everything that they need. And so I would definitely say starting with the district administrators, that would be the best place to start.
I just had another thought is, because I'm just thinking of the ways that I interact with DHS, which is at the Early Learning Hub meetings and system of care. So I'm wondering if system of care is potentially another avenue, because all CCOs are, supposed to be working on system of care. I don't know. I can talk to our system of care person. Again, they don't do a lot, at least in our region, on early childhood stuff. It's more, behavioral health, cross-system involved youth. But I just keep thinking that is a place where a lot of the systems are together.
Okay. Some of them are starting to, like I know at Marion Polk, they're doing a lot more with their system of care on early childhood.
Yeah, I'm trying, man, but
All right, I recognize that we're almost out of time. I don't know, Brittany, if you have any suggestions for us, or we could follow up with you. I know you're pretty new.
Yeah, absolutely. I was actually just taking notes. I meet with Rick, who is our division director, and so I'm sure he'll have a little bit of guidance. Off the top of my head, I know we meet with the Housing Stability Council, but I know they don't talk real in detail, especially about like home visiting. We also have a few committees that are being stood up within the next several months, and maybe that might be a good place in some of those. But yeah, I can definitely follow up on that and see what information I can get for you.
Great, thank you so much. All right, thanks, folks. This was super helpful. I think Peg, I'm going to turn it over to you. Yes,
Great.
we can.
I think we can finish up. Just so thank everybody for coming today and the robust conversation. I think we all appreciate that. The next meeting of this committee is going to be on the 13th of May. So again, I think we all agreed that every other month was going to work best. And the time will be the same. It's that second Tuesday. And then if people are planning their summers out, July 8th will be the subsequent meeting. And there's a couple of upcoming work group meetings that are printed on that slide. So if anyone is interested in participating in those, that's the times.
And Peg, just a quick heads up for folks. Speaking of summer, you will be getting a survey with 2 potential dates for our next Home Visiting Leadership Summit. The 2 dates are unfortunately the same week, so we may miss some folks, but they're August 21st and 22nd. So be on the lookout for that really quick survey and let us know if either of those work for you or both, because we're going to try to get that on the calendar right away.
Great. Great. We'll watch for that. All right. Any other business? Thank you, everyone. And
Thanks,
Thanks,
everyone.
everyone.
Have a
Bye.
good rest of your
Thanks,
day.
Peg. Take care.
Bye.